Hello everyone, and thanks for watching. I'm Dr. Langdon, and tonight's video is going to be about cow's milk protein sensitivity. So some people call this cow's milk protein allergy, CMPA, but really it's more of a sensitivity, and that's what we're going to talk about. So this video is particularly for parents who are dealing with excessively fussy infants. Now remember, there are some previous videos that discuss colicky babies, the period of purple crying, reflux, normal baby poop, things like that. So we're certainly not talking about a scenario where your baby is just occasionally cranky when it's hungry or has a wet diaper, or it's just almost repeatedly, predictably cranky in the evenings, maybe around 6 to 10 o'clock at night, but fine all the other times, because that sounds like the period of purple crying. Those things are not as much of a concern. That's not what we're talking about. And always, I have to put out this disclaimer, guys. You know that if you are seriously concerned about your baby and you think that they're excessively cranky, particularly if there's difficulty feeding, decreased urine output, any trouble breathing, any fever whatsoever, under 3 months of age, greater than 100.4 degrees rectally, you have to call your pediatrician. Always discuss these things with your pediatrician, obviously. This is just an attempt, as usual, to try to educate and hopefully reassure when appropriate. Now, what we're talking about with the cow's milk protein sensitivity is a difficulty for the baby to absorb the proteins that are in dairy or cow's milk. Don't get this confused with lactose intolerance. Remember, lactose is a sugar or a carbohydrate. It's the milk sugar. So lactose is what's in breast milk as well. That's not related to cow's milk protein sensitivity. That's an entirely different thing and usually doesn't develop until an older age. The cow's milk protein sensitivity is an early infant problem because it has to do with difficulty absorbing that protein in large chunks. And so the solution is to either avoid those proteins, which are casein, C-A-S-E-I-N, or whey, W-H-E-Y, in either the form of formula, so you have to use an elemental formula in which the protein is broken down completely down to the individual amino acids, or if the baby is breastfed, then the mom has to stop consuming dairy in her diet, including anything with those ingredients, casein and whey. Now, for the moms who are breastfeeding, this is discouraging, I know, because it's hard to live a life without dairy. But remember, this is temporary. Not only will at one point in the future you decide to wean the baby, even before then, we hope the baby will sort of outgrow this cow's milk protein sensitivity. This is not a true allergy because an allergy is the sort of thing that would give you hives, difficulty breathing, a swollen throat, violent vomiting, diarrhea, swollen lips. And this is not what we're talking about. We're talking about a gut problem. So we talked about difficulty digesting or absorbing large chunks of protein across that intestinal wall, that mucosa. Well, if you put tiny little pieces of protein in there, it doesn't trigger all the inflammation. So the babies who have a cow's milk protein sensitivity, what's happening is the lining of their gut is inflamed. And I just imagine it much like the lining of your nose with the cold. It's puffy, it's red, it's irritated, itchy, uncomfortable, it makes mucus. Same with this lining of the gut with the cow's milk protein sensitivity. So in the baby's stools, you may see big blobs of mucus, just like mucus that you would blow when you had a cold, the kind of stuff that comes out of your nose, and you may see streaks of blood mixed in with that mucus, okay? Now there's a different thing called intussusception. If you just see a grossly bloody diaper full of blood that looks like you dumped a jar of raspberry jelly in there, that's different and obviously an emergency. Cow's milk protein sensitivity is a problem, but not generally a true emergency. It deserves a call to your pediatrician or a visit, certainly, to discuss all these things. So if your baby is on formula and you need to use a formula that will not further irritate this sensitivity, there are 3 major brand names of infant formulas on the market these days in the United States, and those are Gerber, Similac, and Enfamil. Gerber's is what is it? Extremely hydrolyzed, I think is the one of theirs. They have a similar elemental formula to answer to the other brand names of Similac is called Alimentum and Enfamil's is called Nutramigen. We often use Nutramigen the most, it seems. That's just what I've had the most experience in, but all of them being elemental formulas should be absolutely appropriate. There are even store brands, and I personally am okay with store brands if you look at the labels and see what it compares to. Everything in the United States has to be FDA approved before it's marketed, so I think that we're relatively safe from that standpoint, but it does need to be an elemental formula. There are lots of resources out there for breastfeeding moms who need to try to cut out casein and whey. And the good news is because of so many children having allergies and adults with allergies, almost everything now is labeled. If it has dairy, it should tell you that, so you'll know to avoid it. What's tricky, especially here in the South, is when you're used to eating a lot of casseroles or mixing things together, you really have to be careful with that if you're avoiding dairy, because it's so easy for there to have been butter added or cheese added and things like that. No more pizza with cheese on the top. You know, there are a lot of things. This is going to change your diet a lot if your baby has a cow's milk protein sensitivity and you're breastfeeding. But here's the good news. I have had so many parents who were dealing with this extraordinarily cranky baby. And sometimes these babies also have difficulty gaining weight, because you can imagine that picture of the lining of the gut we discussed, puffy, red, swollen, irritated, making mucus, bleeding. Ugh, sounds horrible. They're extremely fussy because that hurts, and they may have difficulty absorbing appropriate, adequate nutrition across that irritated gut wall. So often these babies with a true protein sensitivity have a failure to thrive or poor weight gain, as well as that marked irritability, greater than normal. I don't want to scare you though if your baby's cranky. Remember that 3-week to 3-month period of purple, the period of purple crying. They're really cranky during that as well. But this is even above that typically. Now, one of the ways we diagnose this primarily is just from the blood in the stool and from the history and sitting down and talking to you. Certainly if we saw a drop in the growth percentage in the weight percentile at your well visit, we're going to be more concerned about this as well if you've said the baby's extremely fussy. Sometimes the parent may see a streak of blood in the mucus. Sometimes you may not see it, but all the stories sound so perfect for it. We might check a little test on the baby's stool called a hemocult in the office, and then if it's positive, we would say, okay, this is most likely a cow's milk protein sensitivity, or some people call it allergy. Now, some parents become obsessed with this little test, this hemocult, and think, oh, we need to repeat this constantly. Did I accidentally have a cheat day and got a little bit of dairy in my diet? I need to check the baby's stools to see if it affected them. No, you really don't, because even once you're perfect on your maternal diet of eliminating all dairy and those proteins, casein and whey, you could still have a positive hemocult now and then. It doesn't mean you're doing anything wrong or that you're harming the baby, okay? The other question we get is, this is a very common question, what if I have pumped a month's worth of milk, not knowing the baby was cow's milk protein sensitive, and I was still on dairy then? Don't throw away breast milk. There is never, I can't think of any good reason to throw away breast milk. That stuff is just absolutely liquid gold. Do not throw it away. Because here's what happens. As the babies grow, the lining of that gut gets better at absorbing protein and will generally outgrow this. So there's different things we can try. I usually around 9 months will say, if the baby's still breastfed, Mom, I want you to try 1 teaspoon of just plain yogurt. Eat it. And now just watch for a few days. If nothing happens next time, try 2 teaspoons. And you keep increasing the dairy in your diet to see if it bothers the baby. Are they excessively gassy? Do you see a little tiny streak of mucus or blood in the stool? Are they bloated acting? If something weird happens or they really feel bad, well, stop, back off. No more spoonfuls of yogurt. Go back to the strict diet and try it again a month later. And you keep trying till they tolerate it. Many children, many babies can actually themselves drink dairy and regular whole milk after a year after they've outgrown that. Now, some outgrow it by 10 months, some by 14 months. Everybody is different. So we generally do those little teeny trials. We couldn't do those trials if this was a full-blown IgE-mediated anaphylactic type allergy, because then that could be life-threatening. That's not what we're talking about. We're just talking about it might irritate their gut if they're not over it yet. So it's definitely worth a try as they outgrow it so you can expand your diet. Now, some extremely strong breastfeeding supporters feel that we pediatricians maybe overcall this diagnosis and then put that mom in the position of having to eliminate dairy from her diet, and it's so discouraging, and she blames herself that she gives up breastfeeding. Do not give up breastfeeding. Breastfeeding is so important for the baby. This is not your fault. This is a baby gut problem. So I would rather you save that already pumped breast milk and just try to use it later. Don't throw it away. Because it's a similar question if mom says, oh man, I accidentally had a casserole at that family reunion. I didn't realize it had a little bit of butter in it. Should I pump and dump for 24 hours? Are you crazy? Don't ever get rid of pumped breast milk. And I would just, I mean, if it was a tiny little slip up, I was just feed through it, unless you're dealing with excessive fussiness, and then maybe pump and freeze, but don't ever pump and dump just for this. It's not worth that. Okay, so it is an issue. It is a big deal, but it's not life-threatening, thank goodness. And so many moms, even though they're discouraged about having to give up the dairy, they are so relieved to figure out why their baby's cranky that it's worth it to eliminate dairy from their diet. And they'll come back at the next visit and say, oh my goodness, I have a sweet, happy, cooing, smiling baby. They're sleeping better. They're happier all the time. Totally worth giving up milk for, you know, this first year of life, or for however long it takes for the baby to outgrow this cow's milk protein sensitivity. Now, in a similar vein, I've had parents who, when the baby is formula fed, who were just fussy babies. So many babies are fussy babies. We can look at those previous videos, that they said, well, should I just try Nutramigen just in case it's cow's milk protein sensitivity? And I would say, well, Nutramigen or any elemental formula, I just use that like we say Kleenex for all tissue when I say Nutramigen, any elemental formula. I'm not trying to discourage you from using Similac or Gerber's products or store brands, but if you are independently wealthy, it's more expensive. If you don't mind a really bad smell to the formula, because it's, in some ways, you think about it, it's like throw up. It's pre-digested. Literally, these are the individual amino acids from the protein. So it smells like it's pre-digested when you're mixing up the formula. It's nasty. But if it works and if the baby will take it, certainly it's not going to hurt anything. I just want you guys to understand that the medical indications for using Nutramigen are just this thing, this cow's milk protein sensitivity, not just my baby's fussy, I'll use the most expensive formula. They're worth it. I mean, you can. It's not going to hurt the baby to use an elemental formula. It's just not necessary if it's just a matter of outgrowing this period of purple crying or whatever else could be making them fussy. But it's certainly okay to do that. So let's say you did that just for fussiness. This happens a lot too. Maybe I'm seeing the baby for a 4-month well or a 6-month well. The baby never had documented blood in the stool. You didn't see it and we didn't check for it, or if we did, it was negative, but you just decided to use elemental formula anyway, which is fine if you want to. And then you come at the 4 or 6 month well and say, well, gosh, they're happy all the time and they're smiling all the time because they're out of that period of purple crying. Should we stop the elemental formula? Well, you could at least try a different one that's not quite as expensive and quite as nasty, and that would be fine. And so just ask us at the well visits and we can discuss that and see what's going on with your baby. But a lot of babies are easily able to transfer to a less broken down formula. You may even want to try the partially hydrolyzed, which are the ones like Total Comfort or Gentlease or Soothe, just to get them sort of a stepwise off from the completely hydrolyzed formulas. So I know that's a little tricky. If you do have a baby who's diagnosed with this, I don't want you to ask for us to just keep checking those hemocults every time you come into the office, because it's really not of value. If you've got the diagnosis, you know what to do. We can't just keep chasing that over and over. It doesn't give us really useful information, so it's absolutely not necessary. I hope this answers some questions for you and that you found it helpful. If so, if you're not a subscriber, I would love for you to be. And please like the video if it was helpful. Thanks.